Podcasting from Dallas, Texas, I am Shireen, and this is the Yumlish podcast. Yumlish empowers people with chronic conditions like type 2 diabetes and heart disease to take charge of their health through diet. And this podcast is created to amplify the voices of patients, health professionals, employers, and community members who are working to reduce the risk of these chronic diseases and put your health first. On this episode, registered dietitian Yvonne Greer talks about the importance of cultural relevance in nutrition, the impact of COVID-19 and racism on health disparities within people of color, and the impact of social capital within food insecurity. Ms. Yvonne Greer, owner of Why Eat Right, nutritional consultant for healthy living, conducts special workshops to promote healthy, nutritional, and living behaviors. Her ultimate goal is to reach as many people as possible to assist them in being healthy and living a long and productive life. Welcome, Yvonne.
Thank you for having me.
Absolute pleasure having you on. So with that, I want to dive right in. And I want to ask you, what led you to work within nutrition and specifically within diabetes care?
Well, I will always start off with what I call my mission moment, because this has been something that started way back when I was 12 years old. When my grandmother, she became ill and she went to the hospital. My mother met her at the hospital and she was actually in a coma and on a stretcher. So I saw at 12 years old them bringing her into the hospital emergency room. And I could not believe, that she was that sick. The next day, well, we stayed there a while, and then they told us that she was stable and we can go home. The next day, when we went back to the hospital, my grandmother was sitting up in the bed, smiling, just as sweet as she always have been. And then my mother said, "Well, what was the problem?" The nurse said, "Oh, she's a diabetic. She'll have to watch what she eats. She's gonna be fine." And from then on, I was like, oh my God, can food actually make you like that? Can food actually, cause you to be that sick? So that's really started me wondering, what does food does in the body once you take it in? And that really prompted me to really look into a dietitian. I graduated from school when I was 16. So my creative writing teacher told me, what she asked me, what do you want to be when you grow up? And I said either a dietitian or a creative writing teacher. And she told me be a creative writing teacher. She told me to be a dietitian. She said that journalists, there's a lot of starving journalists out there. And that sealed it for me, because I love the food, I love to eat, and I did want to make some money.
So that pushed it in that direction, huh?
That pushed me right into that direction. And there's an end to that, to the story, is that as a dietitian, that when I was first out, I was about 20. When I was about 25, my grandmother went into the hospital again with complications of diabetes, and she had went into renal failure. It wasn't until that time that I found out she never received a diet instruction from a dietitian. And she went to her doctor religiously. And from then on, I said I wanted to reach as many people as I can, especially in diabetes, to make sure they have the information they need to stay healthy. My mother became diabetic at probably in her 60s, and she's now 83. And the only time she calls me is when she has to tell me what her hemoglobin A1C is, and that is so good. And so, like I said, once I became really interested in it, I found that the style that I have with diabetes, people tend to be able to grab hold of it and then make it a lifestyle change that they're very comfortable with. And so I'm
Mhm.
very pleased with that.
Mhm. And so I want to talk a little bit about your style. So one of the key things, at least we've seen, is highlighting that cultural relevance in nutrition, particularly for those with diabetes. How can a lack of cultural relevance negatively impact healthcare outcomes? Again, specifically for those with diabetes. And then what do you see as solutions for placing greater emphasis on this?
Well, culture is kind of like the foundation by which everyone grows up with, and they grow up on the culture of foods, that they are used to, and some are healthy, some are less healthy. And so my philosophy is that everyone can eat right and traditionally with the traditional foods with knowing some of the basic ingredients. A lack of cultural sensitivity in eating really tunes people out. The success of having people change their eating habits to a healthier style. Many times, people who are not culturally sensitive, who might say just don't eat that anymore, don't understand the context and what that food means. I particularly feel that food means more than just the vitamins and minerals that the person takes in. So if you know that cultural context, when you say soul food, what does that mean to you? And some people don't, the word soul doesn't mean anything, but the long tradition of, the African enslaved Africans working from sunrise to sunset, and then they get in this food that's good for their soul, that replenishes them, but that has meaning to a weary body. And then that social gathering around that food that brought people strength, that brought people to say that we can last another day. There's a lot more context to it. So now you're going to take the food out that's been passed down from tradition to tradition that people have grown to love because of the love that was put in it, then you're going to lose people. And I've had some people that started off with me in classes, and when I was working at the health department, um, I did go into community centers. I did do different work at the different uh, like community centers and clinics, and some of them even because so many people were coming to my classes, like having 30 to 40 people come every 2 weeks. They said, "Well, we need our own RD because we want to have an ongoing program all the time." Well, the person that they did hire was Caucasian. She wasn't as culturally sensitive. And some of the clients, if they would see me out, because I was still around, they would say, "Oh, Miss Greer, the lady, she needs your help. This is what she's telling us." And they're telling us to cook our greens this way. That is not going to work. Nobody's going to do that.
Mm.
Now, when I tell them take the green, put some smoked turkey or some lean chicken meat, season that meat first, and put your greens in there. They understand. I know how it tastes. I know how it's going to be at the end. They were willing to try and do that. I even might have a tasting session so they can see that it still can taste good and you can still have your greens. There's been a lot of research that show when you have those healthy makeovers of traditional foods, that still give that person that feeling of culture while eating healthy, and that you get more success that way than just trying to say just eat a whole different way.
Mhm. Interesting. So you're based in Milwaukee, and I'm curious to learn, how has COVID-19 been impacting the lives of your patients, again, particularly for those with diabetes, and how have you had to adjust your work in order to respond to this pandemic?
Well, just like all places across the country, the racial makeup of the people who not only get COVID-19, but those that are succumbed by COVID-19 has a racial connotation. And that's the same in Milwaukee, that especially in the districts that have a high African American population and Hispanic population, that they are having higher rates of contracting the illness, but also now African Americans have been continue to have the highest death rates. The clients in Milwaukee are fearful, yet because of some of the jobs that they still have to go out. They still have to work. These are things that uh, are really impacting the community. With my work, we found ways to do some programming with like our peer educator. We have a peer education programs where um, people who have diabetes are peer ambassadors and are working with two other individuals. So we have like 10 peer ambassadors, and that means we have about 30 in the cohort right now. We had to stop meeting because of COVID-19 and didn't know how we were going to meet again. We had another meeting virtually, but we also paid attention to the idea not only that we wanted to have people who can go online, but we wanted to have people who can just call in to make sure that they have a way to connect, because there's so many of our people that don't have internet access. So that idea of internet access, it can reach some, but there's a quite wide majority that cannot be met. So we are looking at other ways of reaching those individuals. The phone, texting, those types of things is definitely what we are now utilizing. But it has made us a little more distant to the population that we want to service. I did a lot of on-site workshops. Now I'm doing a lot of uh, virtual workshops. And because people are starting to get used to it, I'm finding that there's more and more people. The other thing I've done a lot is a lot of Facebook Live workshops. That has really been a positive because people can look at Facebook on their smartphones. Again, you don't have to have the internet access to do that. And that has made a big difference, and people can call in, ask questions. So, it's changed. It hasn't stopped, but it has changed. What I found in the individuals is that they want more specifics. Where before, we talked about the my plate and the composition. They want to know out of all those foods, which is the best ones, which is going to boost my immunity, which is, are the ones that's going to reduce my risk of having COVID or surviving COVID, because they hear all the media saying that diabetes is a risk factor. So they want to know, is there something I can do, and what specifically? So it has really made an increased awareness that it's just not okay to just kind of halfway control your blood sugar, halfway be in it. Now you need to be in the game real. And, a lot of people are saying that they didn't realize that they weren't healthy, or that this is not healthy.
One of the things that you just mentioned with the impact of COVID on people of color, diabetes has always disproportionately impacted people of color. Now COVID is just amplifying that. Milwaukee County last year declared racism as a public health crisis.
Yeah.
Has this helped initiate change or create more equity within the healthcare system in Milwaukee? And if so, how so?
I would say the potential to create change is there, because they just started it, and it is an enormous toll to take, an enormous um, kind of journey to take people on, is that we're at the beginning. What's starting to happen is policies. Say, for instance, the Milwaukee County now has a policy that every single department has to reevaluate all their policies and procedures using a racial equity lens, to say, how is this affecting people of color? How is this affecting our hiring practices? How is this affecting our staff as we go forward? And the same thing is happening at the state level. Awareness training, lots of trainings are going on right now. I conducted an awareness training with the Wisconsin Public Health retirees, because I'm chair of the retiree group. And that retiree group is people who have been working in public health, but also people still have influence in many of the um, churches, many of the public health settings. And our main issue all across the state, I'm doing the retirees, but other people are doing um, other different groups like nursing and your community health workers, is how does the impact of whiteness affect achieving racial equity? And so when you start looking cross culturally, I'm leading a group of high percentage white professionals in addressing their awareness of whiteness. And we think that everybody, intentionally knows. No, sometimes they have made what they call white normality that's the norm. So the way they see it is normal. But then if you have people of color that is disproportionately affected by racism, health disparities, inequity, injustice, in so many different places like housing, hiring, um, education, in all these different areas, and yet it's not even seen by some people as an issue, you can't get real change to happen. With George Floyd and the different shootings, we just had last night a young man had some domestic situation going on. Police were called. They shot him in the back 7 times, and Kenosha is in fire. And it's so when you look across the country and things are raging all over the place, there's a trauma, even if you're not involved, there's a trauma that's involved. So now you're putting trauma and pain on top of trying to promote health promotion, trying to say we should do this, we should do that, when in essence, people are feeling in almost survival mode, meaning that after a while, I don't have time to care about that when this is happening over here. And although people, know logically that even though, I don't know that person, but it's in your face, it's happening real time. You can see the videos, you're in the scene. Sometimes I have to tell people, and I had to do it myself, that I can't keep up with everything. That mentally, physically, emotionally, sometimes you have to pull back. And that's hard because, we want to support our young people. Sometimes they think the older people don't support, but it's so much stress and trauma with it. And over time, I tell people, you can have a little PTSD. I feel like I have a little PTSD from racism that's super imposed right on top of everything. I tend to want to say, though, that, you know, there is hope if we can make changes. So I stay in the game to make the changes, to be the voice, to lead the discussions, and it's not always been easy because some people don't even understand that. They don't understand the impact that's going on with racism. And so that's where the awareness comes in. We're in the awareness mode, we're in the assessment mode, and in a few minutes, and I was saying to give us another couple of months, we'll be in that action phase of actually changing things for the better. One thing that did get changed recently, they demoted the police chief because of handling of the racial issues in the area. And so change is going to come. Some may like it, some may not, but change is going to come. And I try to stay involved and stay in the action of it all in a way that I can.
You talked about the impact of trauma, and just so our listeners know, so you're also getting your doctorate, which is
Yes.
amazing, and you're doing a lot of research around the impact of social capital on food insecurity. So I'd love to learn a little bit more from you about how you define social capital and then how it impacts food insecurity.
Social capital is really a term that can encompass a lot of different things, from the structural side of social capital, meaning your connectedness to others, connectedness to your environment, to what they call bridging social capital, where you're connected to your physicians that can refer you or dietitians that can refer you, to what your community have, and what type of connectedness you have to, like, governmental food safety net organizations, or to your informal sources like your community supported research, agriculture, or your farmers markets and that type of thing. So your connectedness to others is the wealth of support that you can have. And if you are not socially connected and socially isolated, many times you do not even eat the same. You don't have the same ability to provide for yourself. And so that's the type of research that I've been looking at. And COVID-19 has been really impacting that. It's really cut down on our connections. And so that's something that, when it comes to food security, that we have to look at. Because, so, say, for instance, even transportation to get to even a food pantry has been cut down. The food giveaways. It's one thing to have the food that people are getting, food boxes and things. Another thing to be able to access it. So how
Mm-hmm.
connected are you to be able to access? Transportation is even part of what I'm studying as part of the environment of social capital.
Mm-hmm. Interesting. And so, on top of that, you are getting the Griot Award for having a stellar career and the ability to storytell in the way that you do, and you have even on this podcast today. How does it make you feel to get this award, and what does it really mean for you?
I am very, very much humbled by getting this award. This is an award given by the National Organization of Blacks in Dietetics and Nutrition, called NOBADIN. And it is a group of um, dietitians from all over the country, dietitians of color. And one of the things that is so important to know is that many times African American dietitians don't get the recognition that they really deserve. Some people don't even know we exist. And in the Dietetic Association, we're only about 2% of the whole Dietetic Association. And so
Mhm.
this is really an award by my peers. And I am so humbled by receiving that award.
That's lovely. That's lovely. Well, congratulations on that
Thank
award.
you.
One of the and we're actually rounding out toward the end of this episode here, so we'd
Yes,
love to close the episode by thanking you for your time, which thank you so much,
thank you.
and really letting our listeners know how they can learn more about your work and stay connected.
Well, I many times, excuse me, I'm on LinkedIn. And so you can look for me under YE Wright. And another thing is that I do feel like, if anyone wants to email me, they could email me at YE Wright, Y as in yellow, EATRIGHT, at AOL.com. And then, we can connect there. I am on Twitter. I am on Facebook as well. You can look for me under YE, right? And then, you can see some of my work. But just keep in mind that this is an ongoing mission for me. And I would appreciate anyone who would like to get back in touch with me in the future.
That's lovely. And what we'll also do is we'll link up your email, your social media, all those different things within our show notes, so folks can access it there. So with that, Yvonne, once again, thank you so much for coming on. We truly appreciate your time and for sharing your knowledge with us, and for all the great work that you're doing in the community, and specifically for people with diabetes.
Thank you. Thank you for having me.
So find Yumlish on all the social media accounts linked in our podcast show notes. Our Yumlish socials help you learn more about our mission at Yumlish, keep you updated on helpful tips for managing your diabetes, and giving you access to exciting opportunities with Yumlish. With that, to our listeners in Texas, Yumlish will be running a diabetes management course here in the Dallas region. If you are interested, email us at info@yumlish.com, and we'll connect you over to that. Lastly, if you enjoy Yumlish podcast and know a healthcare expert working in the nutrition space, reach out to us on Instagram to nominate them. Send us a DM telling us who you want to nominate, what they do, and why you believe their work is making a difference in the lives of individuals to conquer chronic illness. Thank you again. Until next time, stay well. Thank you for listening to the Yumlish podcast with Shireen. If you like our show and want to learn more, you can find information at yumlish.com. You can also leave us a review here. We will see you at the next one. And remember, your health always comes first.